Hello, everyone, and welcome to Chapter 8 in your pathology book, Cardiovascular Pathologies. So, just as a quick cardiovascular system review, remember it plays a major role in maintaining homeostasis. There's that magic term again. Most of the body cells, like everything that makes up your body, are embedded in tissues and are stationary. They can't move around to go get oxygen and nutrients, and they can't remove carbon dioxide, heat, or other waste that they produce. Instead, fluids interact to serve those stationary cells. One of those is the blood, which is part of the cardiovascular system, interstitial fluid, and lymph, which we will talk about in Chapter 9. All right, blood transports the oxygen from the lungs and nutrients from the digestive tract to the body cells. Interstitial fluid surrounds and bathes the cells and tissues and functions as a medium for exchange between the blood and the tissues. Oxygen and nutrients move from the blood through the interstitial fluid into tissues. Carbon dioxide, waste, heat, and cellular products such as enzymes and hormones move from the tissues through the interstitial fluid, and some of the interstitial fluid then enters the blood, which carries them away from the tissues. So this image is just a review look at the types of blood cells that you have. We have the red blood cells, the erythrocytes, the platelets, also known as the thrombocytes. Remember, these help in clotting. And then we have white blood cells, the leukocytes. We have granular ones and non-granular ones, which are part of our immune system. This image is a cross-section of the heart and the paths that deoxygenated blood. That's blood that's already gone through your body and taken out all of the oxygen and the nutrients and has added all of the waste. This is the blue, and oxygenated, the red blood travels. This next image is the conduction system of the heart. This is the pathway of electrical impulses in the heart. Now, I'm not going to go over these in super detail. They are indeed in your book, but these are more in depth in MTC 115 when you take advanced anatomy. Hopefully you have already done so. And you will get a much more in-depth look at the cardiovascular system. If you want to go over this in depth and you want some more information about the veins and arteries and blood pathway in the body, as well as the electrical conduction of the heart, please reach out to me. But we're just going over a brief overview. This image is pretty cool out of your book because it shows the pathway of blood through the body. This is on page 235 in your pathology book. Again, it's a very brief overview in your book, but there is information from the beginning of the chapter until page 235 if you need to reacquaint yourself with how the cardiovascular system works. Just like every other part of your body, as you age, your cardiovascular system starts to age and tank with you. There are several significant changes that occur in the heart and blood vessels with aging. The heart can enlarge, which reduces cardiac output and increases the risk of congestive heart failure. The endothelium, or internal lining of blood vessels, loses elasticity and is less responsive to postural changes. And this, along with changes in cardiac output, increase the likelihood of orthostatic hypotension and varicosities in the lower extremities. Of course, you could also get arterial plaque, leading to potential heart attacks as arteries narrow and thicken. You can get carotid artery diseases, abdominal aortic aneurysms. The list goes on and on. The short story is, please be very aware of potential cardiac issues in your geriatric clients especially. Anyone after the age of 50 is going to be declining in cardiovascular health on average. But your geriatric clients are the most susceptible to having issues, and we will talk about the various pathologies next. First, we're going to cover disorders of the blood, pathologies of blood supply or blood makeup. And the first one that we're going to talk about is anemia. So anemia is a reduction in the quantity of either the red blood cells or their hemoglobin, all which impairs the blood's ability to carry oxygen to the cells. So it's a pretty common blood disorder, currently affecting about 3.5 million people in the USA alone. And there are a couple of different types of anemia. So we have iron deficiency anemia. This is the most common. It's associated with the depletion of iron in the body, which impedes the synthesis of hemoglobin. They very often test juveniles for this, especially young babies, well into toddler stage for iron deficiency. People that have hemophilia, which we'll cover later, or people that have any type of blood issues, like with blood loss, like with severe cases of endometriosis or PCOS, which is polycystic ovarian syndrome, where you may be losing an abnormal amount of lining every month and bleeding profusely. That can also lead to anemia. There's also pernicious anemia, which is characterized by larger than normal red blood cells. They get huge, and because the hemoglobin molecule within the red blood cell remains the same, the result is a subsequent reduction in the oxygen carrying capacity. These large red blood cells are destroyed prematurely, so almost like, remember when we talked about gigantism and they tend to die prematurely? Well, giant red blood cells also die prematurely. Bigger is not always better. Folic acid deficiency anemia is the next one. This is similar to pernicious anemia, and it's characterized by larger than normal red blood cells. It comes along with a malabsorption of vitamin B12 and a lack of intrinsic factor. You can feel numbness and tingling in the finger and toes, and you can also begin to develop dementia. Now, this image is showing you sickle cell anemia. So this is a micrograph showing normal red blood cells in picture A, and B is a close-up of a sickled red blood cell. Sickle cell anemia or sickle cell disease is characterized by red blood cell destruction. Sickle cells are characterized by a change from the normal disc shape to a crescent or sickle-shaped. And because of that abnormal shape of the red blood cell, they're subject to a destructive process called hemolysis. All right? These misshapen cells have shorter lifespans. They live about 20 days instead of 120, and they obstruct small blood cells. All right? Small blood vessels. So their shape is so much wider and flatter and oddly shaped that it can block off all of the small vessels. In the United States, about 1 in 500 children that are of African American descent will have sickle cell anemia. It is a genetic trait that is much more prevalent in that community, and people of Arabic and Mediterranean descent are also at higher risk of this disease. Those from Latin American countries are also at a slightly than higher risk than Americans that are of European descent. Our last anemia is aplastic anemia, and that results from bone marrow failure, leading to a decrease in red blood cells. It not only lowers the red blood cell count, but it reduces the white blood cell and platelet counts due to its inability to create new cells. So this image shows you the possible manifestations of having anemia. On the left-hand column, we have acute manifestations, and on the right-hand side, we have chronic manifestations when you have had anemia for longer than 3 months. All right, there can be issues with your brain with acute manifestations, such as thrombosis or hemorrhages causing paralysis, or sensory deficits. These are to watch out for in your massage clients, or death. Hopefully they're no longer your massage client. You can have issues with your lungs and abdominal organs. It can even help you develop gallstones. You can have issues with your bones and joints. There's something called hand-foot syndrome, which is painful swelling of the hands and feet. And issues with your kidneys. You can have hematuria, which is blood in the urine. Now, there's a lot of causes for blood in the urine, but this is one of many that could potentially cause that to occur. Now, if you have anemia chronically, you can have problems with your eyes, such as blindness, retinopathy, hemorrhaging, pulmonary issues. You can have hypertension. You can have tachypnea, heart issues like high output failure, congestive heart failure, issues with your spleen, your kidney, your penis, your skin, stasis ulcers of hands, ankles, and feet. Ulcers are something we absolutely have to watch out for. This is also prevalent with neuropathy. All right, so what does this mean for a massage therapist and all of these various issues that can occur with anemia, okay? So if a client indicates that they have anemia, the therapist needs to ask them which type. It's fine in terms of getting massage for anemia related to nutritional deficiencies. If the client chills easily, make sure that they're covered with a blanket or an electric table warmer. If they have difficulty breathing, certain body positions can be used to help them breathe during the massage session. All right. While the client is seated, be sure that the client's feet are flat on the floor with elbows resting on the knees. When the client is supine, elevate the client's upper body and head while resting the knees on a bolster. While the client is sidelined, elevate the client's head and place a pillow between the knees. Avoid the prone position or limit time spent in this position. Now, the image of the hand is of pallor. This is on page 239 of your book. It's just an absolute lack of skin color on the left palm in comparison to the other hand. And then the foot image is again of petechia. You can very often see petechia in some clients with aplastic anemia. And this is the blood spotting on the skin. All right, our next blood disorder pathology is leukemia. This is a word that nobody wants to hear. This is a cancer of the blood involving blood cells and blood-forming organs such as bone marrow and the spleen. Most leukemias cause accumulation of immature or dysfunctional white blood cells, which results in overcrowding of these cells in the bone marrow and in the bloodstream. These circumstances reduce the number of normal blood cells, and eventually leukemic cells infiltrate lymph nodes, the spleen, liver, brain, and other organs. There's an estimated 60,000 new cases of leukemia and almost 24,500 cancer-related deaths in 2016 alone, and most of those occur from overwhelming infections. Of course, this is a little outdated in your book. Of course, it is several years later, so some of our numbers have changed. There is some exciting news now about some mRNA vaccines that are being created thanks to the COVID-19 vaccine that was created, where they are doing preventative vaccines for a multitude of cancers. And there's been some very exciting cancer trials where we are seeing all of the participants in the study being cured. So if you are interested in that, please, the times are changing. Look into this research. But back to massage therapy, because that's what we are focused on. Ask your client about current signs and symptoms, as well as side effects of all cancer treatments. I would definitely get a doctor's note for anyone with cancer, just making sure that they're cleared. Sometimes it's absolutely indicated, and sometimes it most certainly is not indicated. Every client is different, and every body is different. So please definitely make sure if your client has leukemia that they are good to go for massage. Slow stroke back massages usually reduce pain and fatigue and help improve sleep in adults with acute leukemia, especially undergoing chemotherapy. Gentle massage improves the quality of life and decreased anxiety. Massage also reduces cortisol levels in people with cancer, such as leukemias, who are undergoing chemotherapy. And, of course, reduced cortisol levels are associated with improved psychological well-being. Massage and reflexology, remember that's a type of foot massage, decreases the side effects of several cancer treatments. And parents who massage their children with leukemia reported improved mood and decreased depression. White blood cell and neutrophil counts increased in children who were massaged by their parents. So that's an interesting outcome. You can also look at the Miami Touch Institute for studies with leukemia and other cancers and manual therapy such as massage. And there's some interesting things that you could do for outside research as well. I know that for clients that I have worked on that have undergone radiation therapy, adding things such as calendula flower petals, either as a tincture or into the massage medium, has really improved skin quality. But those are all side notes for another time. Let's move on to hemophilia. Hemophilia is a genetic disorder that impairs the clotting mechanism in the blood. Hemophilia is the most common bleeding disorder, affecting approximately 18,000 people in the United States. Now, guys, every time I say it's the most common or the least common, this book is very USA-centric. It is not global statistics. We have a very narrow vision here based on American healthcare and American genetics. For the most part, this country does not mean that these are global statistics. So please keep that in mind when you hear me throwing out numbers. That is just the number of people in the USA that are being tracked. And this book typically does its research in 2016. All right. So bear that in mind for all of these pathology chapters, please. All right. There are three types of hemophilia. They're A, B, and C. And in each case, a different clotting factor is missing, making the task of blood clotting difficult or impossible. Type A, or classic hemophilia, accounts for 90% of cases. Type B is called Christmas disease, and type C is Rosenthal hemophilia. Okay, so people with type B lack factor 9, and people with type C lack factor 11. Type A, factor 8 is deficient. Just think of Henry VIII, type A, all right? What does that mean for massage? You have to use light pressure. This image right here is what happens if firm pressure is used or someone gets a bruise and they continue to bleed underneath the skin. Any type of injury with hemophiliacs can lead to a hematoma that just keeps spreading because their blood just doesn't stop. They do not clot internally or externally like you normally would, all right? Absolutely use light pressure. An example of light pressure is a 3 on a 10-point pressure scale. I would put your fingertips on a scale and put no more than maybe 6 ounces of pressure, honestly, for someone with hemophilia, which is extremely light pressure. And also bear in mind, because of possible damage in the joints from hemophilia, you cannot use aggressively applied passive stretches or joint movements. Do not move these clients around aggressively in any way, shape, or form. Let themselves move slowly. Please watch out for points on your tables. Sometimes tables that are used for mobile massage as well as being stationary in a massage office will have big knobs on one side or the other where when you fold the table up, you can set it down on the ground, and that's how it sort of protects itself from having your padding rub. Please make sure that those are covered appropriately, because even though those are usually just rubber, they can bump into a client's skin when they're moving about and cause a bruise. And you certainly don't want a client leaving your office beginning to look like this image. Okay, hemophilia was a lack of blood clotting, and now we're going to talk about blood clots. Blood clots, or thrombi, are a mass composed of blood cells enmeshed in a fibrin network adhered to a vessel wall. If a clot breaks free from the vessel wall and flows through the bloodstream, the freely floating mass is known as a thromboembolus. When an embolus occurs or occludes or obstructs a blood vessel, it's called an embolism. Blood clots don't normally produce symptoms until their presence begins to occlude actual blood vessels. At this time, symptoms will depend on the location of the affected vessel. Like obstructed cerebral arteries will show signs of stroke, like sudden muscle weakness, dizziness, difficulty speaking, or defects in vision. Obstruction of the carotid arteries includes sudden severe headache and the signs and symptoms of stroke. Blood clots in the leg veins will show symptoms of a deep vein thrombosis, or a DVT, which we will cover in just a little bit. So, massage therapy and blood clots. If your client has blood clots, absolute contraindication. No. Fever, red, stoplight, no. Postpone the massage until the condition has resolved. Additionally, screen your clients for DVT who are at risk of blood clots, including those who are obese, have had recent major surgery, have cancer, are pregnant, are taking oral contraceptives or hormone replacement therapy, or if they've been inactive for prolonged periods, such as those who need a wheelchair or are bedridden, those who have been sitting for many hours, driving or flying, and those who smoke. Signs and symptoms of DVT are unilateral leg swelling, heat, redness, pain, and tenderness. The skin over the affected area may appear discolored and may even ulcerate. If your client has any of these signs or symptoms, postpone the massage and refer the client to his or her healthcare provider for evaluation and treatment. Deep, vigorous massage to the legs can release a blood clot, which is scary news. All right, so this image is of an embolus and embolism. A thrombus or blood clot dislodges, becomes an embolus, and occludes a vessel, causing embolism. So what is embolism? All right, an embolus is a floating mass in the intravascular space that is carried by the blood. When an embolus occludes a blood vessel, the condition is called embolism. This occlusion can cut off blood flow to an organ, causing serious injury or death. The most common offender is usually a blood clot. This image is of a saddle embolus. This is a type of embolus that sits astride a bifurcation within a blood vessel. Signs and symptoms usually include severe pain in the area. An area can become pale, numb, or cold to the touch. If a large artery is occluded, someone might start getting nauseous, vomiting, fainting, and they might even get shock. A pulmonary embolus is characterized by shortness of breath, chest pain, and again, potentially shock. An embolism is a medical emergency requiring immediate medical attention. So obviously, this is our fever red stoplight. This is an absolute contraindication. If you suspect someone has an embolism, please do not massage them. Call 911. Up next, we have shock, which is a failure of the cardiovascular system to deliver sufficient amounts of oxygen and nutrients to meet the needs of the body. Shock represents a series of events that, if left uninterrupted, results in death. Your book quotes Samuel Gross, who in 1872 wrote, "Shock is the manifestation of the rude unhinging of the machinery of life." So we have 4 major types. We have cardiogenic shock, which comes across as heart failure and is caused by myocardial infarction, heart valve disorders, heart infections like myocarditis and endocarditis, and other problems with the heart. We have hypovolemic shock, caused by hypovolemia. This is massive hemorrhaging, excessive urination, like you can see in untreated diabetes and severe vomiting and diarrhea and severe burns. You are losing too much liquid. Anaphylactic shock. This is generalized vasodilation, so your blood vessels are just spreading. This is caused by an allergic reaction to insect stings, drugs, nuts, and shellfish. There's also septic shock. This is caused by severe or multiple infections, also results in generalized vasodilation. And the fifth one, I said there were 4, I lied, there are 5. Neurogenic shock. It is also generalized vasodilation, and it can be caused by extreme pain, extreme fear, spinal cord injuries, or hypoglycemia, where you can actually have insulin shock. Shock is a medical emergency requiring immediate medical attention, so massage is most obviously postponed until the condition resolves. If you think your client is going into shock, call 911 immediately and ask the client about any allergies before massage to prevent ingredient reactions that might lead to anaphylactic shock. Absolutely. Especially some of these higher end massage creams contain things like lavender, which some people are allergic to, arnica, which can cause severe heart palpitations. There are any number of essential oils in most of the massage offices I have encountered, many of which are contraindicated for various conditions. I don't even know why people have things like tangerine oil, which dry out your skin on top of everything else. But please ask your clients about any type of allergies before you even finish your intake. Like if it's a new client and you happen to have them on the phone, ask them before they come in. You want to make sure that any aromatherapy you have in your office is not going to be triggering to them. Now we're in the exciting world of arrhythmias. Arrhythmias is a deviation from a normal heartbeat or a rhythm. Anything that deviates is an arrhythmia. This term encompasses abnormally fast, slow, or irregular rhythms. The heart rate of an average healthy person can be between 50 and 80 heartbeats per minute at rest. Tachycardia is a heartbeat of over 100 beats per minute. Guess what? Thanks, long COVID. A lot of people have them now. I actually have long COVID myself, and I underwent a surgery in the end of 2020 and the beginning of 2021, where they gave me the incorrect medication. They gave me albuterol, which helps open up your airways to breathe better. It also causes tachycardia, but I'm really allergic to it. And I now have what's called supraventricular tachycardia. It's an SVT. I now have a permanent heart condition where my heart just randomly goes super, super fast. And the only potential cure for that is to have heart ablation, which is like a type of heart surgery. So tachycardia can definitely be no joke. And we are seeing a huge uptick in people with tachycardia thanks to long COVID now as well. There's also bradycardia, which is a heartbeat lower than 50 beats per minute. There's a really awesome group of people that are free divers that have changed genetically over the years to be able to lower their heartbeats to ridiculous amounts. We're talking like 20 beats or lower per minute to be able to free dive for several minutes at a time, far longer than anyone thought that someone could stop breathing for a while to dive. Fascinating stuff. There are also free divers that have been known to be able to control their heart rate to go down extremely low. So arrhythmias are common. They're frequently harmless and don't always indicate disease. You can measure these with an ECG or an EKG, and that'll normally be what detects it. Arrhythmias can be called dysrhythmia or irregular heartbeats. So massage is indicated for people with arrhythmias. However, if your client has difficulty breathing, certain body positions can be used to help them breathe more easily during the massage. So we've already gone over these seated, supine, and side lying positions. But the major thing to notate here is that if your client feels dizzy or lightheaded, and this also goes for anemia, while sitting up or standing after the massage, it might be related to orthostatic hypotension or a sudden drop in blood pressure that may last up to 3 minutes. Ask your client to sit back down and remain in the seated position until the feeling of dizziness has completely subsided before standing and walking. If your client has a pacemaker, let's check this out. So a pacemaker is a small device that helps individuals control arrhythmias, usually bradycardia or slow heart rate. So it sort of jolt starts it to go ahead and beat again. The device is about the size of a $50, and pacemakers monitor the rate at which the heart beats. And if it beats too slowly, it will send electrical signals to the heart, which increases its rate. So ICDs and pacemakers are usually surgically implanted under the skin. They're on the chest or in the abdominal wall. If you look at the image here, you can see where it usually is. I have massaged a lot of clients with these. You can palpate them quite easily through the skin, even on someone who is obese, because it is just subcutaneous. It is not very deep at all. It's pretty superficial. The thing to remember is that the tips of the leads become attached in their positions by fibrosis. All right, that takes about 6 weeks to occur. So during those 6 weeks, you need to avoid joint movements and stretches of the pacemaker side arm or the neck. I would say your book doesn't include that there, but I also wouldn't do any heavy stretching or pulling at the neck or even the trap muscles, because this disturbs the lead connections. All right, as a comfort measure, you can place a small pillow or cushion between the device and table, if they're lying prone during the massage at all. Don't ever do any cross fiber friction after those 6 weeks. We don't want to break up any of the fibrosis or adhesions that are holding that in place. And this also goes for things like loop recorders, which are normally implanted in the chest. They stay underneath the skin for up to 3 years usually. In women, they will be placed in the left breast tissue, or I should say those with heavy breast tissue, men and women alike, they will be placed in that breast tissue versus over the sternum. It will be off to the side in that subcutaneous tissue. All right, angina pectoris. Angina pectoris, or angina, is chest pain from a temporary reduction of blood flow to the heart. Approximately 6 million people in the U.S. experience angina. The first symptom is usually left-sided chest pain, especially with exertion. Some people say it's squeezing, tightness, pressure, or heaviness in the chest. Sometimes they say it feels like someone is standing on their chest. The pain may radiate down the inner side of the left arm and upper back to the neck or the throat. You could have nausea, disorientation, fatigue, shortness of breath, anxiety, and profuse sweating may accompany an angina attack. Once the attack is over, blood resumes its normal flow and the pain is relieved. A lot of times a panic attack can mimic this as well, so please keep that in mind. Clients who have a history of angina attacks will most likely have medication with them, like nitroglycerin. It's either in a tablet form or aerosol spray. Please, if you're going to help your client with it, maybe toss on some disposable gloves, especially if it's a spray. Ask the client to sit or lie down for 5 minutes, because dizziness and fainting can occur as a medication side effect. Right? And this is an image from your book on page 245. These are pain referral patterns during an angina attack. These are typical. Sometimes I will say these are typical for men. Sometimes it does come across a little differently in women. But overall, these are the average pain referral patterns that your client will express. This lovely photo is of a myocardial infarction, a heart attack, myocardial infarction. So in A, you see an area of occlusion and the myocardial infarct. And in B, you see a cross-section of the heart showing infarct and resulting scar tissue. These are all the yellowish and darkened areas that you see there. So an MI, or myocardial infarction, or a heart attack is a sudden disruption of blood flow to the heart muscle or myocardium caused by an occluded coronary artery or hemorrhage from a broken coronary vessel. All right. The tissue that's supplied by the affected vessel is often damaged, and this means your heart tissue is very often damaged. The signs and symptoms kind of looks like angina. There is severe substernal, below the sternum, or left-sided chest pain. It's often described as crushing, burning, or vice-like pain with the feeling of fullness or massive chest constriction that is not relieved by rest or administration of the nitroglycerin. So if your client who normally takes that nitroglycerin is, I'm having an angina attack, and after those 5 or 6 minutes, it's not being relieved, call 911. This image is of medical outcomes of people who experience myocardial infarction, again, a heart attack over time. So a lot of people have sudden death, from the arrhythmia. There are early complications of arrhythmia, 90%. We see late complications, and we see chronic left heart weakness over time and recurring heart attacks and arrhythmias at the decade point after surviving. What does this mean for you? Well, if a client tells you that they've had a previous heart attack, first of all, don't work on them a day later, please. But even the first week afterwards, they're still at a small percentage risk of having heart rupture, 12% risk of shock. Arrhythmia is indicated for massage, but there's a 90% chance that they still have an arrhythmia. A year after it, they could have some type of thrombosis or embolus. They can have an aneurysm. There's a 10% risk of that. The arrhythmia, which is the most benign of symptoms, has dropped down to 20%, but there can still be issues. Again, a decade later, they have chronic left heart weakness. So please, no vigorous circulatory stuff for those that have had heart attacks in the past. Definitely ask about problem areas and potential blood clots when you work on these clients. All right, if they're having an active heart attack, I shouldn't even have to say this, but heart attacks are a medical emergency. Please call 911. This is, again, a fever red stoplight issue. Do not massage them. Next, we have congestive heart failure. This term, CHF, refers to the inability of the heart to pump blood to meet the body's demands, okay? Looking at the other chart that we just covered, even a year after a heart attack, your complications include 70% chance of congestive heart failure, all right? And even a decade after having a heart attack, you have a 70% increased chance of congestive heart failure. It's also just known as heart failure. It's not a single disease. It's a syndrome or complication associated with many other diseases, such as hypertension, chronic obstructive pulmonary disease, or a previous heart attack. The term congestive is used to describe what happens as one or both sides of the heart fail. Blood backs up into or congests the lungs, liver, and other organs, and the lower extremities. It can occur as an acute episode, but it's usually a chronic condition with possible acute episodes. It affects approximately 5 million people in the United States. So if the left side fails first, blood backs up and congests the lungs, resulting in pronounced respiratory difficulties. You'll have a shortness of breath even when laying down, coughing that might produce like pink tinged sputum that comes out or is foamy or frothy, and waking in a panic, gasping for air from sleep. They can also get fatigue, exercise intolerance, dizziness, an enlarged heart, and tachycardia. If the right side fails first, blood backs up and congests the liver, gastrointestinal tract, and limbs. Venous congestion results in vein distension, especially the jugular vein in the anterior neck region. The liver enlarges, causing pain below the right costal margin. The heart can enlarge, and abdominal edema and significant edema of the legs and feet may also occur. Do not come at me for this picture. This is directly out of your book. I didn't even want to look for another one when I saw it. These are some labels of what can occur with congestive heart failure. The edema of legs and feet. I have never seen edema that piled quite like that. Let's just say look for swelling. Don't necessarily look for piling such as this on the sides of the feet. Sorry about that. I had to pause to giggle a little. There is abdominal edema, as you can see from this. You see that bellowed out swelling of the lower abdomen. It's not necessarily a gut, especially if you see a client on a regular basis and suddenly you notice that they're very puffy in their abdominal area and they usually are not. This can be a symptom of acute congestive failure. You see hepatic congestion. Well, you don't see that one. Your liver can become congested. You can have symptoms of an enlarged heart, but this is something else that can occur. Distended neck veins. This is something as a massage therapist that you will be able to see. You will not be able to see pulmonary congestion, but again, if your client is having trouble breathing, no matter what position they're in, they're gasping for breath, they feel very fatigued, or they're coughing up pink foamy stuff, those are all huge signs. This is a medical emergency. Again, fever, red stoplight. Do not massage them, please. If they have chronic congestive heart failure, you have to do an extremely thorough health intake. Figure out what their current symptoms are. Of course, back massage can reduce anxiety and blood pressure. It decreases heart rate and respiratory rate, and all that's great. Massage is indicated for chronic congestive heart failure if a doctor approves it, but make sure they're not having any acute symptoms. Absolutely, before each session. Otherwise, chronic, yes, it is indicated for light relaxation massage only. If your client feels dizzy or lightheaded, we already talked about sitting up and staying sitting up before they stand up to get dressed. In any way, shape, or form, you can help them sit up on the table, with the sheet still properly draped around them. Make them sit there until that dizziness has fully subsided. All right. If you need a break, just hit pause because we're still going strong with a few more of these cardiovascular pathologies. Our next one up is cardiomyopathy, which is a general term for any weakening or change in the myocardium. It's often associated with inadequate heart pumping. Symptoms of cardiomyopathy are similar to those of congestive heart failure and include shortness of breath, even at rest, fatigue, dizziness, tachycardia, occasional chest pain, lower extremity edema. Look for those piling feet again, and abdominal edema. All right. Massage therapy and cardiomyopathy. If your client has difficulty breathing, certain body positions can be used to help them breathe more easily during the massage. Again, when they're seated, make sure their feet are flat on the floor with elbows resting on the knees. When they're supine, elevate the client's upper body and head while resting the knees on a bolster. I do find this kind of interesting. Your book keeps suggesting feet flat on the floor with elbows on the knees. That does allow you to rest the weight of your body on your elbows, stacked on your knee joints. However, this curls your thorax inward and doesn't allow for deep chest expansion when inhaling. So you're not going to be able to take a very deep breath in this position. So just check in with your client before you ask them to sit slumped over like this. They may feel much more comfortable supine with a little bit of support so that they can open up their chest and actually take a deep breath. And again, if your client feels dizzy or lightheaded when sitting up or standing after massage, it might be related to orthostatic hypotension, which is a sudden drop in blood pressure that can last up to 3 minutes with positional changes. So tell them to sit down until that dizziness stops. Rheumatic fever is a systemic inflammatory condition that develops as a rare complication after an untreated streptococcal throat infection. Serious, if you don't get your strep throat treated, you can get rheumatic fever, which leads to autoimmune reactions that damage the heart. We'll talk about rheumatic heart disease in just a second. This affects the joints, the central nervous system, and the skin. It usually occurs in children from 5 to 15 years of age, although you can see it in adults. Not all people will get rheumatic fever after strep throat, but it is a possible complication. Your client might have fever, which is already a contraindication for massage, obviously. Joint pain with a limited range of motion, which people do come in for massage for. Chest pain, abnormal heart sounds called murmurs, and an enlargement of the heart. Other disease manifestations are like this lovely photo, like a rash on the trunk, or they have jerky body movements. Small nodules on the tendon sheaths of the joints, such as the knees, ankles, knuckles, wrists, and elbows, can occur. They can also have a shortness of breath, fatigue, and loss of appetite. All right. Rheumatic fever is a disorder requiring immediate medical attention. If you see this rash, if you see any of these symptoms, please postpone the massage until the condition has resolved. Obviously, they should be seeking help from their primary care physician. All right, so what is rheumatic heart disease? That is the manifestation of heart disease that follows the rheumatic fever. All right, it affects all heart layers. They can have endocarditis, myocarditis, or pericarditis. It leads to valvular damage because of vegetations, particularly with the mitral and aortic valves, all right? The symptoms are sort of the same with congestive heart failure, which is shortness of breath, even at rest, tachycardia, edema of the legs and feet. Again, look for those ridiculous pilings. No, I'm kidding. It's just swelling, fatigue, potentially a dry, persistent cough. So you're looking for an unproductive cough. They're not coughing up any mucus or phlegm. They're just constantly dry coughing, and cardiac murmurs. Again, move your client around if they have difficulty breathing. Consider any coexisting conditions such as congestive heart failure when formulating their plan. Definitely, if you're concerned about any of these cardiac conditions, I would always get a doctor's okay, especially before doing any vigorous massage. Endocarditis is an inflammation of the interior lining of the heart or endocardium. The heart valves, which are folds in the endocardium, are usually involved in the endocarditis. Valvular problems may disrupt blood flow through the heart, impairing its function. It can be a primary disorder on its own or a complication of another disease, such as respiratory or urinary tract infections. Guys, I cannot preach this enough. If you have a UTI, if a client complains about conditions of a UTI, urinary tract infection, yes, TMI, but clients will tell you everything on the table. Always advocate seeing a primary healthcare physician for potentially getting antibiotics. Of course, you can't say, hey, you need antibiotics, but they need to go see their doctor to see if they need antibiotics, because UTIs can lead to some really, really bad stuff in the body, including death. But we're not talking about urine right now. We're talking about the heart, which could be damaged by your urine. But that being said, the signs and symptoms of endocarditis is often secondary to infection, fever, chills, night sweats, fatigue, and a loss of appetite. All right. A new heart murmur or change in a pre-existing heart murmur may also occur. You can see edema in the legs and feet, shortness of breath, and, it's a disorder requiring immediate attention. you should not be massaging this client. You should absolutely tell them to get seen by a healthcare professional. Myocarditis. This is inflammation of the myocardium, the muscular wall of the heart. This condition can be localized or diffused and is often related to cardiomyopathy. All right. The two most common causes of myocarditis are viruses or parasites. Ironically, the T lymphocytes in your immune system that are drawn to the myocardium to kill the virus or parasite also destroy infected myocardial cells, which further contributes to the disease. It can also be a complication of other diseases such as the flu, diphtheria, mumps, systemic lupus, and most significantly, rheumatic heart disease. Signs and symptoms are often vague, making it difficult to diagnose. It can include fever, shortness of breath, fatigue, mild chest pain, and arrhythmias. I know we kind of jumped ahead here talking about myocarditis, but speaking of endocarditis, these last two images are of infective endocarditis and also some of the signs that you will see in clients with it. This includes splinter hemorrhages, lesions, and other things throughout the body that you will see with this. Pericarditis is the inflammation of the pericardium, which is the sac surrounding the heart. Inflammation often causes a buildup of fluid in the pericardial space, which compresses the heart and impairs its function. Other forms of pericarditis result in adhesion formation between the layers of the pericardial sac. So this person might experience chest pain, which remember is called angina, shortness of breath, tachycardia, which is fast heartbeat, edema in the legs and feet, or a dry cough. So a lot of these cardiac symptoms all seem the same. This one might also be accompanied by a systemic infection, though. So they could have fatigue, fever, and chills, but you're never going to massage someone with fever and chills. Pericarditis requires immediate medical attention. Massage is fever, red stoplight, contraindicated. Absolutely tell them to get medical help. Now we are going to move on to diseases of the arteries like arteriosclerosis, which is a hardening of the arteries, and it's a whole group of diseases characterized by the thickening and loss of elasticity of arterial walls. Atherosclerosis, which is a type of arteriosclerosis, is the most common form of the disease, and the two terms are often used interchangeably, all right? Atherosclerosis is the presence of plaque within arteries. These lesions, also called atherosclerotic plaque, can restrict blood flow and promote the formation of blood clots. This is a pathologic process that leads to many other diseases such as angina pectoris, atherosclerosis of the coronary arteries, transient ischemia attacks and stroke, or atherosclerosis of cerebral arteries. People are usually asymptomatic at first, and as they become more obstructed, the symptoms related to lack of blood flow emerge, and it depends on where the affected vessel is for the type of symptom. These are very similar to the ones that we spoke about before. This image from your book depicts the progression of atherosclerosis. The only thing I'm going to say about this in terms of massage is treat it the same as any other cardiac issue, except for do no deeper than a light to medium pressure on the sides of the neck. You can actually break apart some of the plaque and the carotid artery that's in there and potentially cause an issue. So that is one thing to be aware of. Another is if someone has had an angioplasty or balloon angioplasty, that's a surgical procedure used to open up occluded arteries and restore blood flow. They may have a small wire mesh tube called a stent that's been in place. There's no major massage modification. If the stents were deep, vigorous massage is not recommended. like over the actual vessel where the stent is located. You don't want to do anything to dislodge it. Not that anyone technically ever has dislodged one, but please just be aware, ask of its location, and don't do anything really vigorous over that area. I wouldn't do any deep compression, no major percussion, no deep movement in that area at all. And also adapt the massage according to any restrictions that have been placed on the client by the surgeon or other healthcare providers at that time. Coronary artery disease is the presence of atherosclerotic plaque within coronary arteries, which supply the myocardium of the heart. Usually the person is asymptomatic at first, and then the pain of angina pectoris, which starts when the vessel is about 50% occluded, but might not even start until it's 75% occluded. In advanced disease, you can have a heart attack, and honestly, you could have no symptoms until you, boom, have a heart attack out of nowhere. So that's exciting. Given that this may occur with related diseases, it's recommended for massage therapy that you treat it such as you do angina. Again, if they've had angioplasty or stenting, no specific massage modifications are necessarily needed. But again, let's not beat the area up where the stent actually is. This image is of a coronary bypass showing where the grafts have been put in place. We also have peripheral arterial disease, which is the presence of atherosclerotic plaque within arteries outside of the heart. All right, so we have inside the heart, and this is outside of the heart. This is a common disorder affecting 12 million people in the USA every year. About half of the people that have it either have mild or no symptoms. They might have intermittent calf pain that initially subsides with rest, but becomes more severe with time and is not relieved by rest. Other symptoms are weakness, numbness, and fatigue in the legs, and the skin over the affected area may be pale, cyanotic, dry, shiny, or hairless and feel cold to the touch. Sometimes the nails are often thick and malformed, and the peripheral pulses distal to the occlusion become weak or absent. That means you've got less blood flow going distally from the occlusion. The area might become gangrenous because of the lack of blood flow. It starts rotting. And this image is actually of cyanosis, which is a discoloration in the distal ends of the fingers and toes from the cyanosis seen in people with peripheral arterial diseases. Because of the possibility of clot formation, only use light pressure over the affected area, which is usually the legs. You want to just do a 3 on a 10-point pressure scale. If they have a stent inserted in a peripheral artery, deep, vigorous massage is not recommended over that area. Additionally, ask if they have any other symptoms that you're going to want to modify your massage for. If they've been instructed to avoid sharply bending the knee, avoid really aggressive applied joint movements of the knee. Next up, we have aneurysms. An aneurysm is a localized weakness in an arterial wall. I cannot talk today. Blood clots can form in the damaged or dilated areas, which might give rise to emboli. Aneurysms may leak or rupture, resulting in hemorrhage and possible death. This image is out of your book about types of aneurysms named for their specific location. Of course, in the suprathoracic area, you see the thoracic aneurysm, an aortic arch aneurysm. There is an abdominal aortic aneurysm, also known as the AAA. This one you want to avoid a lot of compression in the abdominal area, although you're not really doing that anyway. A femoral aneurysm, which you would see fairly high up there in the inner thigh, sort of in the inguinal region. It's right towards the very top of the femur. Popliteal aneurysm. This is relatively uncommon. But luckily, you wouldn't be doing a lot of compressive maneuvers in this area anyway, because remember, the popliteal region is a cautionary site during massage. Signs and symptoms: thoracic aneurysms can cause difficulty swallowing or breathing. An abdominal aneurysm may result in lower abdominal or back pain with a palpable pulsing mass in the abdomen or weight loss. Headaches and strokes can accompany the cerebral aneurysm. Most of these are all asymptomatic until they rupture, and the person will start exhibiting signs of hypovolemic shock for both the abdominal and thoracic aneurysms, and signs of stroke for cerebral aneurysms. Aortic aneurysms can be diagnosed by ultrasound examinations. So for massage therapy, you only use light pressure over the affected area, usually the abdomen. Your book is recommending a 3 out of 10 on the pressure scale. To be honest with you, even with a couple decades of experience, I generally avoid all known aneurysm areas. I mean, I don't avoid the areas that an aneurysm could potentially be, of course, but if someone tells me that they have an aneurysm, I do avoid that area because you really don't know how thin the walls are, and how easily that could rupture. Not only will that become an immediate medical emergency, that's a huge potential lawsuit, on top of obviously not wanting to potentially kill your client. So I have an overabundance of caution. You do you. The book says just use light pressure. I say get an okay from the healthcare professionals, and I personally just avoid it. All right, hypertension or high blood pressure is a disorder of intermittent or sustained elevated blood pressure. Hypertension is the most prevalent cardiovascular disorder in the United States, with an estimated 65 million people having it. 50% of people are older than 65 years of age. Normal pressure reading is approximately 120 over 80. All right, so this is a little table showing you your systolic and diastolic pressures. Normal is less than 120. Systolic over 80, diastolic. Pre-hypertension is in that 120 to 139 range. Stage 1 hypertension, you have 140 to 159, and of course stage 2 hypertension, which is pretty severe, which is over 160. Hypertension is a sign. Remember, a sign is something that we can measure, not necessarily something the client can feel. So it's not a symptom. They may not know that they have high blood pressure. Luckily, massage lowers blood pressure on average. But there are some signs and symptoms that they could get if they've had it for a long time, which could be like headaches, nosebleeds, which is called epistaxis, fatigue, dizziness, sometimes fainting. Obviously, if you have a client exhibiting any of these, it might not be hypertension, but you're going to treat it as a contraindication no matter what the reason that your client is exhibiting these. Polycystic ovarian syndrome can cause hypertension. Obviously, a variety of heart diseases can cause hypertension. Sometimes it can be a complication or a side effect from medication as well. Now, clients taking antihypertensive medications can be prone to orthostatic hypotension. And again, that's a sudden drop in blood pressure. So, ask them if they feel dizzy or lightheaded. Take all of those precautions like you would for anybody else feeling dizzy or lightheaded. There are tons of studies of massage reducing blood pressure. Again, I refer you to the Miami Touch Institute if you want to see some. Your book has some listed on page 258. It is absolutely indicated for hypertension. Just be careful of those dizziness episodes with those medications. So I've brought up this symptom a lot, orthostatic hypotension. Now, this is a sudden drop in blood pressure when moving from a lying down or sitting position to an upright or standing position. The person may feel weak or confused, have blurred vision, experience dizziness or fainting. Usually these occur within 3 minutes of standing after sitting or lying down. In rare occasions, it can also occur when standing motionless in a fixed position. So clients need to be cautioned to change positions slowly during massage therapy when moving from supine to a standing position. And again, just as we talked, have them sit down until that dizziness subsides. Well, if you needed another reason not to smoke, check out this fantastic picture of Raynaud disease and Raynaud syndrome. So this is ischemia in A, showing pallor. That's a loss of blood flow to an area thanks to Raynaud's, and cyanosis, all right, from Raynaud's phenomenon in picture B. Raynaud disease is a periodic episodes of vasospasms in the fingers and toes. It can affect the tip of the nose, parts of the ears, parts of the cheeks, and the tongue. Approximately 13 million people in the U.S. have it, and it's more common in women than in men. So during the beginning of an attack, the skin in the affected area can turn white from pallor, then blue from cyanosis, followed by sensations of numbness and paresthesia. The numbness might be temporary, effective for manual dexterity, meaning you don't have a lot of that fine motor control anymore, and the skin feels cold to the touch. The client will often complain about feeling cold as well. As circulation is restored, the affected area turns purplish red. This is followed by pain that might sting or throb. Imagine when your hands get really cold from the snow or cold outside and then you get them too hot too fast. This is a similar feeling to those suffering from Raynaud disease or syndrome. So during massage, if the client experiences an attack, apply warm towels to the affected area, not hot, or submerge them in warm water. Superficial warming friction may be performed over the affected areas, adjusting the pressure to the client's tolerance. Between attacks, massage is indicated and may improve local peripheral circulation. Be sure that the client is covered at all times with a sheet and a warm blanket, or use an electric table warmer. All forms of cryotherapy, like ice therapy, including ice packs, are contraindicated. These people are already cold. I promise we're getting near the end. All right, now we have thromboangiitis obliterans. Woo! Is an inflammatory. I got that right now. I can't say inflammatory. It's an inflammatory condition of small and medium-sized arteries of the upper and lower extremities. This picture is of that. You'll see some skin ulcers on the fingers in cases of this disease. All right. Avoid areas of skin lesions while you're performing massage therapy. Okay. There can be intense pain, even at rest, swelling, paresthesias in the affected areas. Nails can be thick and malformed. It often leads to prolonged ischemia and these skin ulcers or lesions. So avoid those during massage therapy and inquire about sensitivity over all affected areas and adjust your pressure accordingly. Your patient may have had an amputation, so make adjustments for that as needed. We also have some diseases of the veins, all right? One is phlebitis and thrombophlebitis. Phlebitis is an inflammation of the veins, and it normally affects the extremities, but any veins, including cranial veins, can be affected. If phlebitis is accompanied by a thrombus or blood clot formation, it is thrombophlebitis. All right, for massage, phlebitis is contraindicated on the affected area because massage may cause pain. Place the client's affected legs on a cushion to raise them above the level of the heart while massaging non-affected areas. For thrombophlebitis, massage is fever, red, contraindicated. That's a big no-no. Here we have an image from your book of a deep vein thrombosis in someone's left leg. You see how it is slightly red. There's a lot of petechia happening, and it is pretty swollen, all right? You can see the edema in the foot especially. It looks like pregnancy feet. Congratulations. DVTs can be pretty prevalent during pregnancy as well, believe it or not. So this is definitely something to watch out for. DVT is an inflammation of a deep vein with thrombus or blood clot formation. Inflammation attracts platelets where they aggregate to form even bigger clots, normally near a venous valve. Typical signs and symptoms are unilateral leg swelling, heat, redness, pain, and tenderness. And systemic signs, the entire body, include chills, fever, and fatigue. The skin may appear discolored and ulcerate. During massage, if your client has a DVT, postpone the massage immediately. Screen your at-risk clients for DVT. At-risk clients, again, like we discussed earlier in this lecture, are those who are obese. They've had recent major surgery. They have cancer. They are pregnant. People who are taking oral contraceptives or hormone replacement therapy with estrogens. People who have been inactive for prolonged periods of time, such as being chair-bound or bed-bound, or those who have been sitting for many hours driving or flying, and those who smoke. Guys, this is the last one. Try not to be too excited. Varicose veins. Varicose veins are dilated veins caused by incompetent valves. What a nice way to say that. They're incompetent. Once they're dilated, they tend to remain so, right? So they vasodilate, but they don't constrict again. The condition can affect superficial or deep veins. Superficial veins lack the muscle support of the deep veins and are therefore more susceptible to varicosities. They're usually located in the legs. You'll see them a lot like in the popliteal area or just below it, subpopliteal. But they're also found in the esophagus and in the rectum with hemorrhoids. The joys of pregnancy, the joys of being obese sometimes. Varicose veins are super common in the U.S., affecting 25% of women and 15% of men. Spider veins are smaller varicose veins that resemble a spider's web. Varicose veins are also called varicosities. So symptoms develop gradually. They'll notice a feeling of fatigue or ache in the legs at the end of the day. The ankles might swell, perhaps leg cramping at night. As the condition progresses, veins appear bluish purple. They're bulbous, they're tortuous, like they twist and they turn, and they feel hard to the touch sometimes. The pain often worsens and is noted that it's worse throughout the day. In severe cases, the skin may even appear discolored and may start to ulcerate. So, when it comes to massage therapy and varicose veins, avoid the area with the varicosities if pressure causes pain or if the client has risk factors or a history of clot formation, such as pregnancy, they're postpartum, they're taking female hormones such as estrogens and progesterone, cancer, they have a sedentary lifestyle, or they're using tobacco products. If skin ulcers are noted over the affected areas, recommend that the client see their healthcare provider for medical evaluation. Less severe ones, small ones like spider veins, benefit from massage, especially techniques that target the lymphatic system. Lymphatic drainage massage improves the range of motion in people with advanced varicose veins. And to do this during the massage, you want to place the client's legs on bolsters or pillows to raise them above the level of the heart. Use alternating gentle effleurage applied with open palms with light pressure towards the heart to promote venous circulation. Now remember, the veins, they've already dumped out all those nutrients and oxygen. You want to get that blood back up to the heart. These blood vessels are super dilated, so they have poor circulation. They don't have that pressure to help push it back up. So you're gently helping it go back up to the heart. And again, your book recommends light pressure is a 3 on a 10-point pressure scale. For lymphatic drainage, your pressure wants to be about the weight of a nickel at the very most. So we're just talking, a couple ounces of pressure, very light. I highly suggest using a small scale and practicing your light pressure techniques. That will do it for this lecture. I'm sorry it was a long one for a short chapter, but you don't want to play around with the cardiovascular system. And all of this information is important because you certainly don't want a lawsuit if you accidentally kill a client. I shouldn't giggle. It's very serious, and it's very prominent in the U.S., especially with the increasing rates of obesity and the current status of healthcare in our system. And again, with long COVID has added a lot of these symptoms into the mix at much higher percentages than what your book is even currently reporting. On that note, have a great week, and I will be with you for the next chapter.